scenarios. Scenario 1 was to look at Kampala and the greater metropolitan area like we did last time. Scenario 2 was to look at Kampala, the greater metropolitan area and the cities. Scenario 3 was to look at Kampala, greater metropolitan area, cities and municipalities. And the task force adopted scenario 3 so that we move beyond Kampala, because the vulnerable people are not only in Kampala and greater Kampala. So we shall be extending beyond Kampala to the cities and municipalities for now. Okay. That's the proposal which we are taking to Cabinet. And the committee also gave us various categories of what we should consider as the vulnerable population. Just briefly, let's say, they include people like bus and taxi drivers and conductors. Basically, we're looking at people who like survive on their daily incomes. Maybe they are not salaried people like the leader of the opposition and myself, and maybe Sarah and the professor there. Maybe for us, even when we're in lockdown, maybe we get some modest salary from somewhere where we work. But these people, a taxi driver will drive his or her taxi. At the end of the day, what he earns is probably what he uses to prepare food. But now taxis are not moving. This person is at home. Okay. So taxi drivers and conductors and bus drivers, people who carry baggage, traffic guides and loaders in taxi parks and bus parks, barmen, DJs, barmaids, waiters and bouncers. The others include
maybe Honorable Mariam Musi, yes. We shall be getting back to that.
The food vendors, the artists, saloon workers, massage parlor workers, teachers in the private schools, teachers in the government schools who are not on the payroll of government, car washers, slum dwellers, street vendors, people who trade in scrap, street children. Those are the categories of the vulnerable people whom we are looking at, who are largely in urban centers.
Okay.
So for now, I can't tell you how much we shall be giving them. That's a decision we shall consider. Their proposals, but we shall consider them in the cabinet on Monday and come up with a final position, which we shall then communicate to the public, and also on when we can start giving out this money.
Okay.
So in a nutshell, that's what is going on in the government, but it's a work in progress.
Wonderful.
Yes.
It's a bit tricky for me because I'm hosting my boss, and well, people might think I am taking a biased side or something at one stage, but we shall be getting back to you anyway.
I grant you immunity so that you should feel free. you should feel free.
Okay. Let me get to the leader of opposition, yes. Honorable Mathias Mpuuga. I think it was early this week, you together with others in the opposition ranks sat together to plan a counter plan on how government should be handling the COVID-19 situation. As the alternative governance providers, that is the opposition, what is the plan you have so far tabled, and probably will be having that as a plan to present to government to share with, as well as pick from and then implement?
You know, first of all, this is a long, winding debate. It's a long, winding conversation, and it requires a lot of understanding and imagination. Without imagination, the issues could be easily lost into, into politics and attendant partisanship. But I hesitate to go into that, and I'll stick to my view of the situation that I've shared with the country, because the questions of the day relate to whether the government's view envisages a perspective plan or some form of fire brigade. And we are not able to pick into what the Honourable Minister was giving us in tidbits as to whether it is a plan of a perspective nature that will go beyond the 42 days, or the 42 days, the transitory days that will take us into a much more longer term lockdown, which is why in my response to the government plan, I questioned for transparency in the manner of this plan. Namely, wanted to understand whether it is a plan of a perspective nature that will also try to figure out the long-term impact of these measures on key economic sectors and by extension livelihoods. We did question the 42 days blanket lockdown, and we offered that probably the better way of dealing with this kind of scenario would be a lockdown that is cascaded. Namely, that whichever you look at it, why would you go for 42 days without providing for what you would achieve in the 42 days? And we offered the option that, look, why don't you do 2 weeks and then offer a week's break? Because a fortnight is the mandatory period in which people tested and found COVID positive will be quarantined and treated. A fortnight will be the time in which people that are probably asymptomatic but positive also are isolated and treated. And therefore, after that, you would break, test the veracity of your undertakings. If it is testing, you do massive but targeted testing. If it is vaccination, you take the same trend, because for us we're thinking both short term and long term, and that would work in the short term but also give you a peak into deliverables in the long term, because then you'll be able to leverage the long term effects on the economy, because we believe that the capacity of government to deliver on austerity measures is too short term. And before you know it, just like the good doctor observed, that the first attempt in the first lockdown was chaotic. I am very sure they left extremely stressed and unable to figure out what they achieved. If you ask him whether he has a report of how they succeeded in offering food and whatever they offered, the question of the day is that as we speak now, we do not even have the basic basket. We want to give people money, but do we have a construction of the country's basic basket for the target groups? And rightly has a list given by experts on the target groups. Some of the vulnerable target groups are short-term vulnerable people.
Vulnerables, yes.
But we have the eternally vulnerable. You know, and if you look at the national figures of poverty, you have people that are being recruited into poverty by disease, by politics, by weather. So the whole thing requires a lot of reflection and imagination, so that we do not act as though this simply arrived like locusts. And that's why we questioned the action of government over the last 1.5 years. We believe we could have done better, and this kind of panic wouldn't have happened, because from the word go, we did educate ourselves on the fact that COVID was here to stay for a while, and therefore we needed to have more perspective reflections on how best to deal with it in terms of mapping the country. Right now we are in panic because we don't seem to have a clear mapping by way of surveillance where the bigger trouble is, which is why we closed schools in haste, and in doing so we did transmit to the entire country from border to border. And this has been with us for 1.5 years. We are questioning all this while offering alternatives on how best and how to communicate to the country and to say, hey, The problem is here. There's no need for panic, which is why there was no need for a blanket closure of the country without offering breaks, because I'm very sure the next time you host me here with my good friend and ask him how far and how much money they have taken to Masaka City, you'll have questioned either of the small money is stolen. My very good friend, the Prime Minister, did say that should we detect that your mobile phone has been receiving over 200 and above, then you do not qualify. I didn't know that they had developed an app that detects people that are not vulnerable by simply ticking on. So it's so problematic, and so that's why I talked about.
You need a long term, and perhaps you're not falling for the short term, the seemingly short term solutions that are coming.
No, that's what I'm talking about, imagination and in good faith. And for the first time, we are not really into political banter. We're trying to speak to ourselves as a people, because these are the kind of times that require leadership and not demagoguery and trying to score political points.
Okay.
And we believe that the government will listen and try to roll back on some of, because there's nobody to defeat in this. The trouble would be that while we are trying to find a solution for ourselves and our people, there are groups of people that believe there's somebody to defeat. I hesitate. I believe there's nobody to defeat, but we have to find synergies that can really offer a total solution to this problem and deliver the country, carry our people through to make sure that there's no further deep economic ruin, that while we are trying to deal with the problem, we do not lose the perspective.
We do not create problems out of our dealing with the problem.
Yeah, of course, on another day, I'll discuss with the people of Uganda where I think the government let us down. And probably when I return, I'll go into that area. But for starters, let's begin on the light note. Those are my views, and I probably we have views on how the probably government would look at immunization, would look at testing, and we offered these in a huge document. I'm willing to share them if I have enough time.
Thank you so much, Honorable Mathias Mpuga, the leader of opposition. We shall definitely get back to you as well in a little while to come. But I was noting down something for you, Sarah. You are from a section that I feel would probably weigh in on this and maybe perhaps give a preemptive kind of option. Money versus food, as was the case. As in food it was last time round. This time round there is a likeliness it's going to be money from the description of what the ideas they've shared as cabinets are. Money versus food. Which for you would be the best option to pass on to the vulnerable persons?
No, before I get into that, Kent, I have a problem with the reducing welfare discussion, handouts of food and vulnerable people. A simple definition of welfare means health, happiness, and fortunes of a person or group of people.
Sarah,
The first, I'm coming. The first defining issue is health. And we are dealing with a public health emergency as a country. So, as the Honorable Baryomunsi was presenting on cabinet strategies on health, I thought the priority would drive us on the health aspects, welfare strategy.
Yes.
The first priority should be health. We have a crisis of people accessing treatment. We have a crisis of lack of essential drugs and oxygen. But the whole country is consumed by debating who is a vulnerable person. Yet, in our Equal Opportunities Act, Equal Opportunities policy and strategy documents, they clearly define who a vulnerable person is in this country. And that's not an issue that should consume our debate.
Is that description the same as what was given to us?
All those categories are mentioned, and then we have both statistics that even give you indicators of who is where and who needs help. So to me, I think as a country, that is not a matter that should consume our time as to who is a vulnerable person. Then why do we have these instruments in place? These issues are already defined for us as a country. On the issue of giving out money, to me even, it shouldn't be a debate or looking for proposals. We have the senior citizens grant in this country that is effectively running on a cash basis by this government. That should have been used as a benchmark on what is the best, you know, approach to reach out to people. I think our elderly, the senior citizens, are the most vulnerable people in this country. This government has served them through that program. So that should be a benchmark. So those two issues take out the debate on who is a vulnerable person and how do we reach to them. Then the concentration should be the crisis before us. Access to testing, access to treatment, access to vaccines, and then how to support livelihoods, to help the health of the society and well-being of the people. So when we sit here and take time debating, do you do mobile money? Do you really, are we serious as a nation?
It's only coming in as a subset to the main set. But as Sarah did make mention of something to do with vaccinations, it also points out at something that happened, was it yesterday or maybe perhaps it was on Monday. There was a registration of about 9,000 people tested. Well, the big question is, how do they get tested? They are locked down, they're not moving. Are the health facilities getting to them where they are? Are they, you know, coming their way or making their way to the health facilities? It's another big question therein. But
yes, but to answer your question, of course, dealing with mobile money transfers, Kenya has implemented that through their livelihood support. It irons out ghost beneficiaries, it irons out middlemen, it irons out all these procurement problems, and it is a more efficient way of dealing with the process. Yes. But the government needs to put in strategies for likely hike of food prices that are likely to cause inflation because the people have enough cash to purchase food and then to take care of the customer price index. Because in the month of April, I think our customer price index, according to UBOS, was 4.8%. And maize had the highest inflation, ranging from 32 to 37% between March and April. So these are the strategies or the issues that the government and the cabinet should concentrate on cushioning to make sure that this money has value to the beneficiaries that are going to receive it.
Okay, thank you so much, Sarah, for that bit of direction. And then, of course, I get to Ramadan. You could be providing a bit of insight, perhaps, because the Honorable Chris Bariomosi is part of the committee that will sit again on Monday. We are wondering, as a public, where should this money come from? Well, they know where it's going to come from, but perhaps as an economist, you could advise, where should this money come from? Are you advising them to cut down on expenses? Could it be perhaps this was not foresighted as the budget was read? Where should the money come from? Ramadan.
Thank you. I don't know why you are worried about money. The minister has not told you that you have a problem of money. Their problems lie elsewhere on how to distribute it. But you are having a very practical question, because number one, this particular financial year is ending in a few days. The new financial year is beginning with a budget which has already been rendered inept by this lockdown because it wasn't anticipated. And therefore, a number of avenues through which government had planned to raise revenue have been impacted, because now government might not collect the revenue it had anticipated, because we are all home, most of us. Most of the businesses have been closed down.
True.
I know there are those essential services which were identified and outlined. But as we know, the economy of Uganda, the way it is structured, the economy which was closed down is actually the real economy of Uganda. True. That downtown you see contributes about 35% of the tax revenue. It comes
35%.
from those people whom now we call very difficult to social distance and also very vulnerable. The way they run around, they create the economic kind of multiplier effect which generates the revenue for government at the end of the day. So government is likely to face some shortfalls on revenue.
Hiccups.
Number two, the other option is borrowing.
Honorable Mariamus, I'm hoping that you're noting this because they are going to be vital for you during the Monday meeting.
Oh yes, I am listening.
The borrowing is the other option which every government in the world has been using in order to bridge the other gap created by the economic slowdown due to the lockdown. Ourselves, we have seen an unprecedented increase in the public debt in the last financial year because of, again, this COVID. In just 1 year, our debt grew by 35%. And it has now hit $18 billion, as the minister told us on the budget day, which is about 65 trillion shillings. That is nearly half of the GDP, nearly half of our GDP. But much as we have borrowed so fast in the previous few months and years, I think this is the only practical window through which government is going to realize some money to extend to the public. Because number one, we usually sit in these chairs on TV and in our bars and in our homes and we say, government, you cut expenditure. Reduce the size of government. These are very easy things to say, but very difficult to implement. Because number one, governments are like this monster animal we used to study in public sector economics, which grows every minute actually. It is growing. And it does not have any kind of programming in it to reduce its fat. It has to consume and grow.
It engulfs.
Everywhere in the world, governments are like it. It's difficult to cut government, especially in periods of crisis. Because also those you are saying, you cut here and there, you are cutting also welfare of those. For example, if you are sending them home. So the option of cutting government now, it was in plan before, but it's going to be very difficult. When you are in lockdowns, and this is just one wave. When you look at historic experiences, pandemics happen in waves.
Keep returning.
It's not discrete. It keeps on coming, then it gives you a break, you think you have gone through it, then it hits you again. And until we have vaccinated almost everybody, these kind of waves will keep on coming. So the option of sending people home is quite limited. The only practical option I see is government getting some money in quickly to continue running, but of course when it has scaled down itself a bit in terms of
expenditure,
the total amount they expend per unit of expenditure. If, for example, we said that let us cut the discretionary budget by half, would Uganda really collapse? Will the sky fall down? I don't think so. If for that half, we are cutting on discretionary. Discretionary means the one where minister in his cabinet and parliament, they have that leeway, that wiggle room to say we cut here and they send some people less money than they were supposed to be sent, which vote. I don't think Uganda will fall down, and I think that option should be on the table. I'm not contradicting myself that government cannot reduce itself. What I'm saying is, we might not see, for example, the number of MPs reduced, or the number of ministers reduced, or the size of civil service reduced. It can't be reduced now, but you can cut on this discretionary expenditure.
Yes.
If people were planning to travel, they will travel less. If they were planning to hold the workshops, they will cut the workshops.
for Zoom.
If they were planning 10 sumbusas in the committees, they will now give each MP one sumbusa. And so on. So that can be done, and some money be realized and support people. But as Sarah has said, we shouldn't limit our thinking, and even government shouldn't limit its thinking to just finding, say, a few hundred billions of shillings or tens of billions to give people food. These handouts, the cash transfer, and we say, yes, let us do that for now. And I think also the leader of opposition pointed on it. We need to look at the bigger picture.
Comprehensively.
To me, I thought, and I even wrote about it. These days I've been writing.
The last time I saw you writing on social media, you were happy about the money option.
Yeah, I'm happy with it. Of course, Sarah has already explained why. But also, I said there are 5 now critical priorities government should look at, because this is not going to be a sprint. This is a marathon. Number 1, government must keep Ugandans alive. And with that, that means we must put the first priority as money
Healthcare?
Livelihood. To treat those who are sick. Because we have left them either to find money to treat themselves or die. I think that should not happen. Government has a responsibility of finding money to subsidize the expenses people are incurring to keep alive in this pandemic. Then number 2, government should also get money and test all of the symptomatic cases free of charge. If somebody has symptoms of COVID and has gone to a health facility, he needs a test. It should be government to provide resources to test them.
Free of charge.
Then number 3, we should vaccinate as many people
as possible.
Now. Because I've seen, look at this football going on now in Europe, the European Cup.
The Euros.
The Euros, as we call them. Now stadiums are about to get full. Actually, next week in Wembley, they are planning for 60,000 people to watch a game. That means the world is reopening because they are now sure they have vaccinated their people. If you don't have a vaccine and you don't test negative, you can't enter stadium.
That is very right.
So if we could test as many people as possible and then vaccinate as many as possible as well, we are clearing the way for Uganda to reopen and we live our lives again. So that's the 3rd priority. Then the 4th one should be now to look after the vulnerable people in the lockdown. Because lockdowns are effective at suppressing COVID. They have been tested. And nobody who's in the right senses can blame government for locking down now the country. We are going to have a crisis. But as they lock us down, I'm not vulnerable. I want to clearly state it.
Categorically.
Yeah. But I know there are so many vulnerable people near me. Some I'm supporting them. Government locked them down. Police is arresting them when they are trying to cross over to go to town, and they don't have food. They don't have anything in their home. So they have to choose the style of death, either to die of COVID or hunger. That, I think, shouldn't happen. I can't blame the government for locking down first and then consider this. But the speed at which they process the help to these vulnerable people that speed should be quite like a Formula 1 now.
Supersonic.
Because we are losing the whole intention, because people are fighting to get into town. And some are succeeding, many of them. I've passed through the town today. There was traffic jam. So many vehicles are in town. Others are moving on foot, and there are so many of them also. So people are not home. And at the end of the day, they are mixing up and taking the virus home. Now cabinet is going to sit on Monday. That means 1 week is already gone. When cabinet sits on Monday, it takes a decision. Now processing cabinet decisions takes time. Now another week will be gone. 14 days of not looking after these people, they will continue going to town. And finally, the fifth one is, after you've supported people, is paying the statutory obligations of government. Now, this, to me, those 5 aspects should be the priorities of government for Q1 of 2021-22. The rest of our plan we had for this coming financial year, let it be scheduled to restart in October. And we first really help the country to get back on track.
Back on track, yes.
So that we get out of this lockdown when it is effective. And to me, that requires to revisit the budget as priority number 1. This parliament should be, when it comes back, it should be looking at this. Budgets are not cast in stone. Revisit it and readdress our concerns so that we can reopen the country.
Thank you so much, Ramadan. Well, those of you that are asking us about Honorable Margaret Muhanga, Honorable Abdu Katuntu, Charles Odongtho. Charles is on leave. Honorable Margaret Muhanga and Honorable Abdu Katuntu opted to actually keep away for a while. You all know what's happening at Parliament. The big query would be, how about the 2 members of Parliament on the panel today? Well, some of them are not as worried as the others, so at least we can have them on the show. Back to the line minister, ICT, that is Dr. Chris Baryomusi. Ramadan has highlighted so much to do with how best the government should be doing its bit in as far as mitigating COVID-19 and the after effects, as well as the current effects are concerned. Sarah highlighted the aspect of health seemingly not being a priority, because for now we are looking at how are people feeding, how are people sleeping, what are they having in the stomachs. I know definitely with the budget that was read, healthcare took about 6 trillion, something like that. Human resource capital.
Capital development is 7.
Yes, about 7 trillion. Now, is the money that is meant for the welfare that you are...
And the water as well.
Yes. Is the money that is meant for the welfare that you are discussing as cabinet and will still discuss on Monday part of the human capital budget, or perhaps that money is coming from somewhere else? And just in case, what is the estimated amount that is going to be spent on that kind of approach?
Yes, thank you very much. You know, Sarah was right to say, why do we narrow down the discussion to relief support? I narrowed it down to that because I was responding to your question when you said the president directed the office of the Prime Minister, the Minister of Gender, to look at the vulnerable people who are going to be affected by these measures in terms of survival. That's why I
was actually meant to protect you, but I let it flow. So I apologize on that.
So the problem was caused by you. What you want us to discuss?
I have apologized, Honorable Minister.
It doesn't mean that our response to COVID is only about that. As you definitely heard the president and as you have heard the government commenting, we are looking at the problem of COVID-19 holistically. That's just one aspect. Because of the lockdown, there are specific individuals who are grossly affected because of these restrictions. But definitely our response as the government is looking at all aspects of managing COVID-19, including treatment, and also prevention.
Honorable Minister,
yes.
Let me just come in a bit.
Yes.
For the understanding of the dear viewer out that side, Perhaps is the package that is going the way of the people going to have an inclusion of health insurance or something?
Let me really put it this way. The discussion we are going to have in the cabinet on Monday is not only on relief and the money being transferred. We are actually preparing a comprehensive cabinet paper on COVID and its effects and implications, including health, including communication, including how it's affecting all of us. So we're not only discussing that money to send to the vulnerable people. I think the biggest aspect of managing COVID-19 is actually the prevention, because we see our hospitals overflowing with cases of COVID-19, and we are trying to do everything possible to ensure that medical care is available in terms of oxygen, ICU beds, and the capacity in the health facilities. But the mainstay of managing this pandemic, even the reason why there is this lockdown and these restrictions, is to address the question of prevention. How can we reduce the numbers of Ugandans who are getting hospitalized? And we really want to once again sound the appeal that let us take these restrictions, these measures, however inconveniencing, however painful they are, in good faith, that they are intended to ensure that you and I survive and see the following day. Because the science of this coronavirus is now known. We know how I can transmit it to you if I am infected with it, and all is being done to ensure that if I have COVID, the coronavirus, let me be restricted so that I don't pass it on to Honorary Ompuga or Sarah or any person. That is the intention of this lockdown and all these measures. And the 42 days as a result of science. Actually, science tells us that somebody who gets coronavirus disease and doesn't get any form of medication can have the virus survive in his or her body from 2 to 6 weeks. So the 42 days, which is 6 weeks, is scientific. I just wanted to comfort Honorary Ompuga that the president and the government didn't just sit and say 42 days. It has where it derives its strength from science, the science of COVID-19. And therefore, the plan of government is comprehensive.
Okay.
It has those aspects of prevention, and the prevention measures are there, and I think known now by most Ugandans. But also, like Ramadan said, for us to contain eventually this pandemic, we must vaccinate as many Ugandans as possible. For epidemics like this, you must vaccinate a critical number of the population in order for you to attain what we call the herd immunity, herd, H-E-R-D. That if you've, and usually we estimate between 60 to 80% of the population. But for each disease, we can compute the numbers based on what we call the basic reproductive number. In other words, for one person who gets infected, how many other people does he infect or does she infect? We use that figure to compute how many people you should vaccinate. Right now, the numbers we have vaccinated are still very small to talk about. So we still need to mobilize resources, bring in many doses of vaccines, vaccinate as many Ugandans as possible to get that critical mass in order for us to suppress the transmission and disrupt the transmission cycle of this virus. And we are getting in the vaccines. The Minister of Health has already been communicating, and the other day we received 175,200 doses of the vaccine. We are also getting 300,000 doses from China. Government has also placed an order for 9 million doses of the vaccine, and we are going to put in more money for the vaccines. The challenge has been that procuring vaccines is not as easy as buying tomatoes from Nakasero market, because you recall this is a new vaccine. There has been a challenge with the supply side. For instance, we gave Ministry of Health initially 18 billion shillings, then we added them 23 billion shillings, that's over 40 billion shillings to buy vaccines. But they have been stuck they have had now to resort to COVAX facility to procure through them so they can access, because as a country, you can't easily reach out the manufacturers to buy these vaccines.
Honorable,
yes.
if I may ask,
yes.
how comes the donations come easy? Is it that the problem is with procurements, that is cash procurements, but donations can come easy?
Yes, you see.
Because so far we've received donations.
Yes.
Yes.
You see, first of all, the vaccines are new, and the manufacturers have been producing low quantities, and there has been rationing of the supplies. For instance, the government had entered into an agreement with the government of India through the Serum Institute of India to procure vaccines from India, because this AstraZeneca was being manufactured by the Serum Institute of India.
Yes.
And an agreement had been struck between the government of Uganda and the government of India. Now, when India got a crisis of COVID-19, they reneged on this agreement and said, no, we can no longer allow exportation of vaccines. So even when we had money, now we couldn't access the vaccines. So it has not been easy to say you press an order from country X to get in vaccines.
Okay.
But now, as the manufacturing improves and the supply side improves, I think it will be much more easier to get these vaccines into the country. And what we are planning is to mix the various types of vaccines, because we've been relying on AstraZeneca, but we know there are other vaccines like the Sinovac from China, Johnson & Johnson from mainland America. We also have the Sputnik from Russia.
Yeah.
These vaccines can work, especially the refrigeration needed for them is normal and ordinary. The other ones like Pfizer, like Moderna, require super refrigeration conditions which our system cannot support. So we have to get money, bring in as many doses of these vaccines, mount a huge vaccination campaign, and vaccinate as many Ugandans as possible. Then we can move towards returning to normal. This has happened in Israel, where they have vaccinated over 60% of the population, and life has now turned to normal. No masking, no social distancing, because you have herd immunity. The population which is vaccinated can protect those who are not vaccinated. So we still have some time to reach there. So when we meet, we are going to examine the budget, as Ramadan was saying. Even if it means suppressing many aspects of the budget so that we put more money on this response, we shall have to do it. Even if it means saying these roads were to be constructed, but we can push them for 6 months. I'm sure I will not die if the tarmac road in Kanungu is suspended for 6 or 8 months. We can still use the Maram road, provided we protect Ugandans and save lives, because people are dying. But the major message really which we want to pass to Ugandans is that these measures which have been announced by government are meant to protect all of us. They may be biting, they may be inconveniencing. Yes, you may be crying that you want your business open, but what sense does it make for you to open your shop and the following day you die? So even the money you want to make, you don't have life and time to enjoy it. So let us heed to these measures. Let us swallow this pain. And our hope is that if all of us religiously observed these measures, then within the 42 days, we should be able to interrupt this transmission, and we should be able to see the curve flattening and getting down.
Well, thank you so much, Honorable Chris Baryomosi, the ICT Minister, and as well, for clarity's sake, I'll consult my documents, the Member of Parliament for Kinkizi County East, that is Kanungu District. Before we take a break, there is a message coming our way from Honorable Margaret Muhanga. She says, the distribution of money, whether by mobile money or cash, will be a very difficult thing to manage as well. Many will still complain of missing out. She further adds and says, the COVID situation is complex. Everyone must join the fight because it's a behavior change disease. She says further that if we observe the SOPs, the pandemic will be defeated. If we don't listen, we shall perish. No one is safe and so we need a concerted effort, not blame games. At this particular juncture, I thank UBC TV, together with the likes of Bukede, Urban, and others that came together, in particular on Sunday, to give us a special edition of Act or Perish. When you act, chances are you will live. But if you don't, chances are COVID-19 will actually take you with it. Let's take a break for now. And when we do return, we shall kick it off with an alternative to exactly what Honorable Chris, or rather Dr. Chris Baryomusi, after all they are both his titles, has just given unto us, but that will be coming in from the Leader of Opposition.
Reduce our MTN Momo withdrawal rate. Now you can withdraw mobile money at the lowest rate. You also get MTN Central Points when you deposit, send, and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rate from 1st May 2021. Everywhere you go, MTN.
COVID-19 chija kugwa. If we get vaccinated now, observe social distancing, wear masks properly, sanitize or wash our hands with soap and water regularly. Together we can defeat this enemy.
What does it mean to be closer together? It's taking the last bus home for a surprise visit. Closer together is stranger finding a connection. It's bringing home something much more than a box. It's the warmth of home, or the beginning of something new. There's magic in sharing the things that we love, because it's those things that bring us close together.
Fellow Ugandans, you know that the current COVID-19 period is a trying time in our lives. However, we still have another threat that has been with us for a long time, and it is called neglected tropical diseases, also known as NTDs. NTDs include bilharzia and worms that cause swollen stomachs. Trachoma causes blindness, and elephantiasis causes the swelling of legs. These diseases are affecting millions globally, and yet they can be prevented by regular hand washing with soap and clean running water, regular washing of the face with a soap and clean running water, keeping dirty hands away from your eyes, always using pit latrines, and discouraging open defecation in your community to avoid flies that carry germs, reporting to the health facility early when feeling unwell. Remember to stay safe and protect yourself. This message is from the Ministry of Health with support from Ascend Project.
COVID-19 chija kugwa. If we get vaccinated now, observe social distancing, wear masks properly, sanitize or wash our hands with soap and water regularly. Together we can defeat this enemy.
Welcome back from the break. It's still edition 49 of UBC Behind the Headlines. My name is Kent, and today, for the recap of who it is that we have on the panel, just in case you're joining us right about now, we do have Honorable Dr. Chris Baryomunsi, he's the ICT Minister. We do have Honorable Matthias Mpuga, who happens to be the leader of opposition in Parliament. We do have Sarah Birete, ED, Center for Constitutional Governance. We also have Ramadan Gobi, sometime a minister, but anyway, policy analyst and economist. We left, am I mocking you, Ramadan? What? Anyway, we left off at a point that we had hoped probably to come through with Honorable Matthias Mpuga to perhaps give us alternatives that they have in case there is a bit of a difference from what government has, that is in accordance to what Honorable Chris Baryomunsi just shared with us. Honorable Matthias Mpuga, are there any differences? During the break, we had a bit of exchange, of course, friendly fire on the panel here, and it was all about COVID-19 being universal to us. It doesn't, look into NUP, NRM, FDC, GEMA, and the likes. But perhaps, could it be there are some contradictory approaches that you have as opposition?
No, it's only the virus that is universal, but its mismanagement is not universal. It's a preserve of those that are, given power to manage it, and I hesitate to join that universality in mismanagement. Okay. So, what I, you see, in these times, we don't offer space for lamentation. That space is non-existent. And Dr. Chris and I know that we extensively debated the COVID pandemic in the 10th Parliament. And I am so worried that the issues we discussed and seemed to have come to terms with are coming back again as though they are emerging issues. Yet we thought we had actually settled that debate. Take an example. We discussed and even offered money, given the government proposition, on the number of Ugandans that were targeted for immunization. And to my recollection, the target was 21.9 million citizens. And the government target was they would achieve that in 12 months. And we offered money. The good doctor is saying, and I agree, that vaccines are not tomatoes.
Not easy to procure.
Not easy to procure. But what about recruiting doctors? What about really providing ICU beds? Are they as difficult as an oil pipeline? So we are really trying to talk about issues that we have discussed and agreed as leaders of our people, that these are doable, and the money was made available. I was expecting the minister to make a presentation to the country as a form of reporting on their achievements. If they had moved as discussed and tacitly agreed, we would be far. And I believe that's where we may want to sound as though we are being partisan and wanting to score political points. But at this point, I think the country was let down by the manner in which government managed and utilized the funds. Up to now, we cannot have a report of the percentage scores on the issues we agreed upon in Parliament and how they would be achieved. The reason
which he says, I don't set my own questions on this show.
You see,
he wanted me to give a comprehensive report.
You see, Doctor, one of the reasons why, for example, business people, the business community is asking for a window to operate is because the citizens are treating themselves in private facilities and they do not see government. The only time I saw, a form of government was some individual acting out of turn, purporting to be, you know, arresting people in the private facilities that are overcharging citizens. And I was like, my foot. You know, under what kind of legal regime is she acting? You know, this is arbitrary, and it just speaks to the failure of government to understand that if you're faced with this kind of challenge, you even reach out and amicably discuss with stakeholders on the best way this can be managed. And of course, it speaks for absence of a kind of protocol in the health sector to deal with the problem. So everyone is doing what they choose, and you know, individuals have their own way of acting, the private sector players have their own way of acting, and people are asking, is there a government in Uganda on this? They say a government in the form of a lockdown. Any form of plausible action to address the issues, it's not existent. We did agree that government was going to recruit more health workers, doctors and nurses, to deal with the problem, because we knew the problem would prolong. As we speak, there's stress in public health facilities. Some of the doctors, some of the health workers have actually fled. Reason? They're not PPEs. My foot. What happened? So, okay, the vaccines are not tomatoes. The PPEs are what? You know, so what do you need? Are they produced by Iron Smith? That we cannot get PPEs, protect our health workers? After 1.5 years, that we can't do that? So this is why there are issues, and you're saying we were let down as a country, we could have done better. If they had moved on the target of immunization, by now we would be simply undertaking tests to find out how many Ugandans have developed resistance to the virus by way of carrying out, tests that are cheaper, antibody tests, because they are not as expensive as antigen tests. He knows it. We'll be doing that, but because we have only had 4%, meaning that at their pace, you need 12 years to reach their target. I don't know how many of us here would be in existence to count the percentages. Probably my friend being a doctor will survive, but not even doctors are not surviving. So did the government go to sleep?
Let's bank on God for life.
So we are into a financial year. We did ask, and ask them, please, we have a problem at Parliament, but you see, Parliament can be called, the whips can sit, and we agree on how to deal with the problem. Management of Parliament can sit, probably constitute immediately the Budget Committee and the Finance Committee, and look at the budget, and roll down some of the nugatory expenditures in the budget, and make money available. We would do that painfully, but at the back of our mind, the money that we provided in that financial year was abused. I am very sure we bought more tear gas than oxygen. So what does it take for sure oxygen? 1.5 years? And we're talking about they are not cylinders. So can we get the tear gas cylinders and put their oxygen? Because they are in stockpiles.
So, Honorable Mpuga,
we are talking about
we did
priorities.
Not give health a priority.
Yes.
And okay.
We even questioned the haste in closure of schools. And the question is, the rumor was in the air for over a month that there was a problem in schools. What became of the surveillance function? Is there a surveillance function at work to follow up this rumor and determine when was it proper to close schools, or could schools have been utilized as centers of control? Because they are more organized than the bus park, where we send children to actually go and transmit in the communities. So these issues are not partisan, but they speak to the frameworkness of government. And we want government to act on its duty, which is why, unfortunately, to my friend, I did not have space to accommodate his promises. The demands are immediate. They are not in the future. So any futurist conversation from my friend is not welcome. Probably he would have begun with an apology that we abdicated the duty. This is not a new government. It was the same government last year when it hit us, the COVID hit us. would
but
probably
they're
think
new
that this
faces.
government is putting
Well,
up things
the
together.
majority are the old faces, but there's a couple of new faces.
Well, we are talking about the same government. The plans do not change by new people. This gentleman is going to ICT is not going to change the plans of government. So I think government could have done better. Somewhere, somehow they went off track. They milked COVID politically and forgot it as a medical problem. At the end of the day, COVID is really ravaging our communities. All of us as individuals are stressed, communities are stressed, the economy is stressed. We are waiting for leadership on this matter. Apparently, I'm yet to see leadership on this matter. Yeah, what we really see are people putting on straight faces and they are failing to listen. We are demanding for, I did speak about transparency in my document in the treatment protocols. He will tell you, probably off air, that the health workers are reporting that there are avoidable death in the wards, the COVID wards, courtesy of lack of synergies between treatment and nutrition. And part of the problem is there are not enough health workers. And we're saying, can we include a care component in the treatment protocol to allow for caretakers, and these caretakers be protected as health workers with PPEs to bridge the gap? Because apparently families are meeting the bill, not government, for the bigger part.
Okay.
So where these caretakers, where the sick are in private facilities, government again has to intervene and should not abdicate to appear as though it is a regulator. Government is now communicating like a regulator. You people, what are you doing there? What are you doing in that hospital? Government is not a regulator. Government is a direct service provider and must act on its obligation. All
right, thank you so much, Leader of Opposition. I think Dr. Baryomusi has noted that down, and as well probably add on the aspect of the shooting prices for treatment, not just COVID-19, but general treatment of health ailments in the private facilities. We once talked about it with Dr. Moriku on the show last time round, but perhaps you could be giving us a better response to that when we return to you in a little while to come. Sarah.
To respond now?
I was. Oh yeah. Let's probably do the ladies first, and maybe the gents first as well, before we can bring in the gent eventually. But Sarah, the response to COVID-19.
Sometimes needs something.
Honorable Minister, I'm saying
we are accommodating it in the COVID language.
Okay, quite interesting. Sarah, I'm about to call for a break because the panelists are becoming a little very, very interesting. Anyway, Sarah, the response we've given to COVID-19, people feel perhaps there's been a bit of bias, and maybe the same kind of response we have denied other ailments in society. How do you take that, and how do you perceive it?
No. I think how COVID, by its nature of spread and the severity, needs the attention it's getting, including containment measures like lockdown. Because if you consider now the rate of infection in communities, I do not think that we have any disease that is capable of affecting and infecting as many people in a short while to the extent of COVID. So it deserves that attention. However, the missing gap is the abuse and excesses of security in mismanaging and mishandling people going to access health care during lockdowns. Because lockdown does not mean that nobody falls sick, and government needs to pay extra attention. Because as much as you are containing and mitigating the spread of COVID, you are not God to put a full stop to the health cycle of other people that need regular treatment, that need regular checkup, including those that fall sick, that are not known to be sick. I was looking at some of the guidelines to say if a chairman knows your sickness, does that stop people from falling sick? I might have no sickness at all, but I can or sick. So I think the measures, we need a proper human rights-based approach to access to health care. Dr. Wariomunsi, we did very terribly in the first wave, and the World Bank report, the verdict is out. For every adult death you saved, you killed 4 children. So I think as doctors, you do not want to repeat this mistake. You can read that report, you can read other studies. We need to clearly look at the conduct of security and management of lockdown, because you have not put a stop to people's other health problems. No. I think that's what makes a difference. But looking at the current response of government, I agree with the leader of opposition, really, that the government dropped the ball when it comes to COVID. Yes, there were successes in the first wave, but we became short-sighted, thinking that, and assumed as if COVID had ended. Yet we were watching globally, COVID was still an ongoing pandemic. And I think until World Health Organization declares the world COVID-free, we do not need to drop the ball on this pandemic. So if you look at the measures, the president was saying his plan was to get, for example, 42,000 beds. And I think what we have is 3,000. I don't even know what proportion, around 3,000 beds. What I don't even know how that can be possible. So if you look at the coverage, we've been seeing coverage in the media of all regional and district health centers. They are all saying they don't have PPs, they have not received allowances, they have no medicine. So there is total absence of government in the treatment of COVID in this case. Just yesterday, there was a video of patient caretakers fighting for oxygen at Murago. It's very pathetic. So if you look, that's why I'm disappointed that people are debating a definition of vulnerable people. When we are unable to treat critical cases in hospital, when we do not have oxygen. So the primary debate should be treating people who are already sick of COVID, testing those that are suspected to be having COVID, availability of essential drugs. People are suffering. All you see is health officials writing in the media, don't self-prescribe. What do you want people to do? You have pushed people to that level. So if they don't self-prescribe, what should they do? Don't die. What are the alternatives? The cost of COVID treatment, the COVID of essential drugs. We are talking about the private operators. It is not their primary duty to control a pandemic. A pandemic is an emergence of the state. It is not an emergence of a private operator. The private operator is only filling gaps, but now they are the main operator because there are no medicines and oxygen in hospitals. There are text messages. Very unfortunate. I'm sorry to mention the late Dr. Catherine Anena. She was sending messages to her friend saying, come and correct me from Murago. There is nothing. I am going to die. And unfortunately, she died.
There's actually another doctor that has passed on today, Dr. Ian something.
I don't know. You know, these are pathetic stories from our country.
Maybe they allocate the monies, but something
you see, we need to see government taking charge of this pandemic.
And that's why
beyond appearing in media,
at Honorable
beyond appearing in media, beyond discussing who is a vulnerable person, you see the whole team. Really, no. Government can do better than this.
Okay. Before we get to Dr. Chris Bariomosi, there is something that has made rounds Ramadan. He's looking at me with those exotic gestures. There is something that has made rounds on social media today, and it's, I think, a drive permit. A drive permit, office of the president, something like that. Whether or not it's true, we are not so sure, but it's indicating to be on the road for 6 months. And somehow, the rumor is already making rounds that probably we might be running into 6 months of lockdown. The economy is already collapsing. Do you, by any chance, see the economy rising back to its normalcy? Maybe just in case we went till December.
before I go into economy, I know wherever you see me, you see economy. There are also aspects which my colleagues have touched, and I would want to briefly comment on.
Please go ahead.
The first one is on diverting the system to COVID and forget about the other ailments. I think in the first lockdown, government learned a lesson. And the president, when he was communicating, he said it. That's why he has left so many vehicles on the road this time. He's saying even taxis can move as long as they are taking patients.
The sick.
Border borders can move as long as they are taking patients, and so on. And that's good. I know there are some people who are abusing that. All of a sudden, everybody is moving with a letter of sickness to go and visit a girlfriend or a boyfriend. Those are there, but they are going to help to really reduce on the numbers that were unable the other time to reach out to a health facility. For example, this today I've taken my own children to a health facility to check, you know, these typical infections of kids. And I passed through all the roadblocks by just telling them I'm going to the
You not
health
mention
facility.
you were once a minister, ex-minister?
Those are yours.
Yes.
We are not into that. So I think this time, Sarah, those fears, I think they should be reduced a bit. People are going to access.
Well enough.
But the truth is, the other time it was tough for the people. Now, coming to your issue of the speculation,
recovery plan, the economy,
the speculation on the length of lockdown. You know, policymakers often take care when they are instituting these lockdowns in terms of, number one, the frequency of the lockdowns, the intensity, and then the length. And I think this time around, the president has been clear that it's up to you people. You are the ones who are giving me what to do. If you do not heed to these SOPs,
yes,
and the infection is multiplied, the cases multiply, this curve does not flatten, I'll lock you down. So it's up to us as a public to ensure that we do not take the virus around, because it's not about the cabinet which is going to sit, that they will say, okay, you open them up, even if the curve is just steepening. The curve has to flatten. And I think it's going to flatten, because now when I look at the numbers, we were in 1,500 the other day, so the ministry telling us they are now 700 something. I think the numbers are beginning to get down, because people are now staying home. Majority of the population is home. And that's why the minister should really help us in the cabinet to quicken decision making. And also to do what the leader of opposition has said, to govern, to lead. Let people enforce whatever decision has been taken by government. If it is to transfer money to the vulnerable, first of all, to identify them. By the way, Sarah is taking it lightly on identifying vulnerable. You wait, you will see who are going to come out as vulnerable. There is elite capture. You will find because the center where these cash transfers have worked better, the center stops at making decisions on the groups of people. Then they leave the local level to identify the people. In Uganda, that is usually abused. They don't let the local people to identify.
But we have district task force.
You find these big people even at the district, those are too far away from the people. They start to identify. And at the end of the day, they start identifying their own. You open a mobile money account, and we send you some money. So that has to be managed very robustly. But now, finally coming to your point, I don't think we are likely to be in lockdown for so long, because number one, the truth of the matter is our economy is a hand-to-mouth economy. And government does not have capacity to feed people, to look after people for a very long time. But also to our societies, unlike those European societies, and the president has been emphasizing this, they are very easy to break these transmission kind of curves, because we are not so crowded, except here in a few slum areas of Kampala and everywhere. But once you break the spread at that community level, for people to first get identified. That's why identification and the testing and then treatment or vaccination is quite
very pivotal.
And it's going to help us. So if the economy really is to recover, we better act so quickly and ensure that we don't undergo a prolonged lockdown or a return to another lockdown very, very quickly, because there it will be catastrophic.
Wow, thank you so much, Ramadan. And well, as we turn to Dr. Chris Baryomusi, I see someone here sent us a message and says, let our dear Honorable Minister, ICT, discuss the issues of COVID-19 related medical mistrust, health impacts and potential vaccine hesitancy from the public. Different signs and symptoms amongst Africans as well, he should be highlighting. This is the one Alex Akampurira. But as well, we wanted you and we opted to hear from you on aspects of, Sarah mentioned people fighting for oxygen. We wonder, is there a policy of sorts or something? Private hospitals, private facilities are charging heavily. Is there any particular, you know, an order to follow or something? Is government doing something about it? People are coughing 5 million or maybe 7 million per day or even more. Is government doing anything about it? We might not have asked you about it, but we need to know what exactly it is, in addition to what the leader of opposition did make mention of.
Yes, thank you very much. Maybe before I provide the specific responses to those, I just want to take you back on a chronological trend of when we realized the COVID, what was done, and why are we where we are. We need to appreciate that. You recall, we call it COVID-19 because the Chinese confirmed this coronavirus, a new virus, at the end of 2019. And at the end of February, WHO declared COVID-19 as a disease of public health importance. Now, on the 11th of March, it was declared a pandemic because it had spread very fast, covering a bigger part of the global world. Now, on the 18th, just 1 week after that, President Yoweri Museveni appeared on television and announced a string of measures.
True.
And on the 21st March, 3 days after that day, we register the index case of COVID-19 here in Uganda. And later in July, we get the index death, the first death. And when government mounted a huge response with those measures, restrictions, lockdown, Ugandans by and large complied. And what do we see? Toward the end of the year, at the beginning of this year, we saw great reduction to the extent that our hospitals were even empty. Even the scientists who are doing research on a drug, on therapeutic pharmaceuticals for this COVID-19 had no patience to try this vaccine on. But let's recall some events. When we went into campaigns, who are the politicians who were choosing government that we are using COVID-19 for politics? And we are instead calling huge rallies of people, knowing that COVID, the coronavirus, spreads when we are in huge gatherings. Who are the politicians who were saying don't put on masks and they campaigned without masks? President Yoweri Museveni held meetings across the country, but he ensured that whoever attends his meetings is tested and is COVID negative, and he restricted his campaigns to few invited leaders. So we can also examine our politics and say who are the categories of politicians who were actually facilitating transmission of this virus. We had debates toward the end of the 10th Parliament where Honorable Mpuga and his colleagues were saying, why is government maintaining a curfew? Policemen are extorting money. You remove the curfew, there is no corona anymore. These debates are unanswered. So government has been a little bit sensitive on this issue and has done its part. So why do we get this second wave? One, when we eased the restrictions and opened up the lockdown, I think there was general complacency in the public. You could go town and find nobody is putting on a mask, even when the government had given masks to Ugandans.
True.
You could go in the villages and find the communal functions, funerals, weddings, church services had gone back to the original arrangement, even when the government had guided on the numbers which should constitute these gatherings. So that complacency which came in, when few cases were being registered, I think majority of us in Uganda thought COVID had been defeated, which was not the case. So that explains why we get this rise again. The second reason why we are where we are is that, you know, viruses naturally undergo what we call mutation. Mutation means, it comes from a Latin word, mutas, change. They change. You know, I don't want to go much into science, but viruses have what we call a genetic code. And that genetic code has amino acids which are arranged in a particular order.
Yes.
When you have a community where you have a big concentration of the viruses, and you know, viruses, the way they increase, that they enter a body cell and they multiply, replicate. Now when we have like what we have in Uganda now, then there are high chances of a virus undergoing that change, and you get what we call mutants or variants.
Yes.
Those amino acids change either by substitution or deletion, then you get new strains of the virus. Now this has been happening. I'm sure you have heard of the Delta mutant, that's the Indian variant. You have the UK variant, South African variant, Brazil variant. You have the Nigerian variant. You have the Vietnam, which combines Indian and UK. So those variants came up, and somehow they gained entry into Uganda, because now we have over 5 circulating variants, which come with different characteristics, different properties. So the viruses which are spreading now are much more virulent, much more aggressive. They are lethal. They kill fast, spread very fast, and that's why you see in this wave more people are dying very fast. Hospitals are full, and you can't blame government, for instance, for the variants, because it's a phenomenon which is global. Now, is the government taking leadership? Definitely yes. There are more patients in the government facilities than what you find in private facilities. It is not true that the government is asleep and is not doing anything. What is happening is that the rate at which the virus is getting transmitted is so high that is overwhelming the existing services, even when we have been trying to improve them. If you talk to the Ministry of Health, they will tell you, since the beginning of the virus, the oxygen plants have been increased in Murago and health facilities. But the virus is spreading so fast that is overwhelming the existing services. And this is a phenomenon you will find in India, you will find in Brazil, you will find in America, you will find in Italy. Even when they have well-functioning systems, the moment the virus is saturating at a higher rate, then it will overwhelm systems even when they are very good. That's why we are focusing on prevention measures. But yes, you recall in Italy, when they were overwhelmed, people died, the Prime Minister cried on television, people came out and threw money in the streets. Would you blame Italy that their systems are not functioning? So even where systems function, Yes, I agree we must improve our systems, but what is happening is not necessarily the weakness of the government or a poor system, but rather because of the factors I have given, we have this huge burden of the virus which is saturating, and the mainstay of managing it is observing the prevention measures as well as vaccinating people in order to halt that transmission cycle. Otherwise, even if you fill our hospitals with oxygen, with the beds, if we don't address the prevention side, you will still get overflows in the hospitals. But the government is doing whatever it takes to ensure that we improve the capacity in our health facilities. For instance, we are getting more oxygen cylinders. I'm sure the Ministry of Health has been clear to say we have enough oxygen, but it's the cylinders which are getting fewer, and we are getting additional cylinders to fill in our hospitals. The bed capacity, we are improving it. It is unfortunate that our private health care facilities, some of them, not all of them, are taking advantage of this dire situation to make money, which is wrong. That's not the teaching of medicine as a profession. And the government, through the Ministry of Health, is engaging the private health sector to see that that is addressed. Because I think the challenge we have is that we don't have a law which empowers the government to fix the pricing in the private health sector, which maybe we should look back and see whether we must put a legislation.
As legislators.
So what we can do now is to engage the private health sector, but the prices which they are charging are quite astronomical and cannot be justified.
Honorable.
It is not true that Ugandans are paying heavily in the government facilities. No. The only challenge is that we are getting overwhelmed with the patients, but our health workers, who definitely are suffering from pandemic fatigue, are doing their best. The PPEs, yes, they may be running short, but it's not true that hospitals don't have gloves, don't have masks. They are there, but we must give more supplies, more PPEs in the hospitals in order for the hospitals to continue to
Honorable,
function.
is government aware of what Sarah highlighted, the security operatives abusing
Yes.
lockdown and curfew?
Yes, coming to that, just two additional things. The indiscipline of our security officers. Definitely when we announce measures, including restrictions on travel, we don't mean that Ugandans should be harassed. No. The president the other day announced that for those who are sick, you need to get a letter from the LC, a referral note from a health worker, or a letter from the RDC, so that you can be enabled to move to a health facility. But that doesn't mean that a pregnant woman who is in labor, if she reaches a checkpoint, you must say, go back and get a letter from the LC. Or somebody gets an accident and is bleeding. So the security personnel, the police officers manning these checkpoints, they carry brains. They should use sound judgment to look at a person. If somebody is breathing heavily and is breathless, really, why would you insist on a letter when you can see that this person is very sick, he or she needs medical attention? So we have engaged the police and the security officers, security leadership, and they have issued guidelines to the security personnel so that they can do their work, but do it humanely without embarrassing and humiliating Ugandans. Will the lockdown last for 6 months or so? You see, all the measures which the president announces are based on science. They are not guesswork. What we do as scientists is that we do what we call epidemiological modeling. We look at the trends and the trajectories, how the epidemic is moving. Like Ramadan said, it will depend on us Ugandans how we behave and respond to these measures. If all of us observed these measures and remained at home and improved on social distancing and we don't affect each other, this trend would come down. So after the end of the 42 days, if we see that we have substantially improved the trend and it's coming down, then we can open up. But should we spend the 42 days and we see there is no improvement and things are getting worse, Then the few openings which are there, we may have to cross them. Because yes, we are mindful of the economy, but I think life first. Life first. The primary objective is to save lives, then the others can come later. So the amount of time we shall spend in the lockdown will largely be determined not by the president, not by the minister, but by us, Ugandans, on how we behave, on how we observe these SOPs, how we take seriously these measures so that we can bring down the infection rates.
Dear viewer,
and as government, we are also doing whatever is possible to bring in whatever is required. The vaccines, the medical care and the health facilities,
TPEs,
and all these issues.
All those things. Dear viewer, or probably listener, act now or continue being locked down. You know what I'm talking about. The Honorable Minister has just made mention of it, and probably we need to be getting into action. Honorable Matthias Mpuga, Leader of Opposition, you are well known for mobilizing. How far so far have you mobilized, and how are you mobilizing to see to it that this scourge of COVID-19 is fought successfully?
Well, invariably, I never stop mobilizing as long as I am still in the public arena. I have started by mobilizing government out of its slumber.
Slumber.
To positive mobilization.
Yes, and reminding the government of its responsibility to citizens. This I'm still doing until my old friend and good friend drops the political banter with this mobilization. You really had him trying to insinuate on the happenings during the campaigns. But I will tell you that only John Museveni could hold rallies, and he has said so with tested people who had that capacity to
meetings,
do it.
not rallies.
So when you make testing partisan, and in that case they made it a preserve of the friends of John Museveni, and you see where the problem is. We, for example, my partner and candidate never held meetings in urban centers. We were chased. John Museveni successfully held meetings in all urban centers in the country, and wherever he left, it became an epicenter, and we never held any meetings there. The question of the day is, where does the current mapping and surveying locate the epicenters? Is it in the villages where we were, or in the urban centers? So that's why from the onset, I never wanted to delve into politics.
A generalized pandemic where there is a community transmission, both in the urban and rural areas.
Certainly,
the situation is bad.
Certainly, even if it were like that, you would, as a matter of management, locate the epicenters. Because when you do mass immunization, you also do targeting.
We can. So the other day, the president put the map of Uganda showing which districts are heavily affected.
Yeah, that said, I still believe that it's whether the variants from India, whether from Katanga, whether from Nyendo in Masaka, it again remains the duty of government to act on its job and offer solutions, because the ordinary person doesn't know what to do until government comes out and communicates authoritatively. I am still waiting to hear from the minister what became of recruitment of health workers as part of the package we had agreed upon. I am aware that some of the health workers that had been recruited, and a small section, not even a quarter of what they had agreed upon, were not given permanent contracts. Even those on temporary contracts are not properly paid. Those are not supposed to be risk allowance. It's not coming through. So would the minister tell the country how much in terms of risk allowance they pay health workers that are risking their lives, or how many health workers were recruited, doctors and nurses, as agreed and as directed by Parliament? These are the issues, and I don't want to dress them in any politics. They are issues of management, they are issues of care, they are issues of planning, which is why my indictment on government is still out, because these answers are not coming through. And we can never manage this by simply offering defenses for the sake. And you see, the best way of dealing with these kind of problems is by being transparent. And I insist on the use of the word transparency on purpose. Because if you say the private practitioners are exploiting the situation, has government figured out how much they are bearing in terms of cost to government? The taxes they pay on the medicines and other equipment they import. Has government engaged to leverage on this situation to make sure that they develop synergies with the private players, other than threatening them? Because probably in this pandemic, just like John Museveni saw an opportunity to curtail his opponents, they saw an opportunity to leverage on their operational challenges, to say by the time the pandemic subsides, would really have made something, would have creamed off, to be able to pay taxes to government, to be able to equip, to be able to refurbish. So I was expecting the Honourable Minister to brief the country on how fast an engagement with the private players can be achieved so that we can limit the suffering of citizens. Because I know for a fact, for example, in my sub-region in Masaka, the better facilities are owned by religious institutions. But every other day they complain about government failure to appreciate the fact that they are complementing the office of government.
Private players.
Certainly.
Money of the tune of 20 billion.
My friend,
You don't know.
My friend, if you are talking about people who are informed, I'm very informed. And I know what
How much
you're
do we
giving.
give
I know what
private, not for profit health facilities?
I know what you are giving them, and I can tell you that can't leverage on the cost. If you, the tax collectors as government, are failed to equip yours, where do they get the money to equip theirs?
Okay.
So we are asking you to simply act on this job because this is the public duty to which you cannot hire anybody to do it.
Okay.
And it's wherever you go. Just like, let me just say something in a minute.
Yes.
Mr. Govi ably observed what the Honourable Minister is reporting seems to be in the long term. Say we shall have a cabinet on Monday. Today is Wednesday. We are going into Thursday. So how many days have to see the bureaucracy? So is there somebody in government apt enough to act quickly, break the bureaucracy, and offer leadership again on this problem? I get the sense that, could it be that because it's a new cabinet, people are finding, are learning to walk on the red carpets? Is that the case, Doctor?
Tomorrow we try helicopter and teach money.
No. It's not. It's not about money.
Okay. Let's.
Do you want doctors to
Gentlemen, honourable members, let's return to the.
I do not buy into the sluggishness of government on this matter. Somebody needs to really probably pour cold water on some of these ministers to act on.
Whoever is sleeping needs to wake up. Sarah, we somehow, somewhere downplayed the whole aspect of what people are calling welfare, leave alone the general picture which we have discussed, that is the health picture, the health sector picture. The aspect of food and those small tokens that are meant to come the way of the people. Do you feel perhaps if those went the way of the people, there'll be a bit of contentment within the period of lockdown? Probably in 2-3 minutes you can respond to that.
Yes, but Kent, how can people get contented? Let's look at what the challenge is for an ordinary citizen. There is anxiety.
Food is one of the challenges.
No, please give me time to respond.
Please.
There is anxiety on testing and fear of being sick without knowing. That describes the madness on self-prescription, on herbal concoctions. There is this level of anxiety that the government must address. The second level of anxiety is, if I fall sick and I need medication, where do I go? The rich people are failing. The messages from hospital is, we have a bill of 120 million, please contribute. We have a bill of this. So there is that other level of anxiety. The third level of anxiety is on how do I survive and feed my family? So these are 3 levels of anxiety and fear that the government must show leadership on. Many people would wish to test. An ordinary test is 150,000 PCR. How many people can afford that test? How, with the level of COVID, the way it spreads, if you are unable to test and treat, you have lost it. So the most urgent thing is test and treat. for contacts, and now we have reached a level even where we don't know contacts. But can people with symptoms be able to access test and treatment for COVID? Then once you address that level of anxiety, you go to livelihood. How do I survive? Whereas you can survive 2 days on hunger, you cannot survive 2 days on COVID with zero treatment. It will spread and damage your lungs, and internal organs will collapse. So which is more urgent? And I agree with the Honorable Matthias Mpuga, really. Cabinet can have special sittings. You cannot have a crisis and still rely on routine. Then you are failing to respond to a crisis. Cabinet can even meet 3 times. If you have an urgent crisis, like Uganda is faced with. So either we have a leadership or we have a sleeping government, but we cannot be in the middle.
Okay, interesting. Ramadan, because I want us to end with Dr. Chris Baryomusi, but Ramadan, just like Sarah put it, do you feel anxiety will actually block the excitement, the would-be excitement of, oh, government has recalled I exist, they've given me something, when eventually it comes to pass?
No, it shouldn't be even people getting excited. People now, they are, as I told you,
saying, keep your phone on, you receive a phone call from the Prime Minister.
It's about now a choice of the style of death. Should I die of COVID or die of hunger? And for that, therefore, government must respond quickly to ensure that they remove the other option of people thinking about hunger. Because then very many people in Kampala here, especially Kampala Mukono work, so this metropolitan Kampala area, and there may be some few pockets like his city and others. Those other cities, they have just pockets. They are near villages, they can get food. But here, in greater Kampala metropolitan area, government must act quickly if we are to break this anxiety and get people some money to buy food, but also get even the food near the people. Because also now there is a crisis in the villages. The food prices have dropped of fresh food. A bunch of matoke is again 2,000 shillings or less. So we need to get this food near to the people and also get them the money as quickly as possible. It's no longer business as usual to wait. That's why I brought in that why do you wait for Monday for a cabinet decision? Why not earlier, so that next week it's actually operation.
Rolling
the
out.
Strategic decisions have been taken, but to get some money to the people so that they can get food and they stay home. We finish this and then we come back. But you know, Sarah underestimated the issue of welfare in terms of money. Money tends to answer so many questions. What people need now, first and foremost, is money. Those who haven't gotten sick, to stay home, to not to look for the virus, to stay home. You know, I usually tell,
She agrees.
I usually tell my students that, you know, there are those people who tell you that money is not everything. No, money is everything. If you want to really test that money is everything, you don't have it. You will understand that money is everything.
Okay.
So now that government has decided we are going to give people some money, and it's not a lot of money. At the end of the day, they will tell you some little money to survive, and people can survive on it for a couple of days. Let it get to the people quickly. Let this system be robust enough.
Yeah.
Because you know, also when you are acting fast and at a broader scale, then corruption becomes fertile. Also. The ground is fertile. So,
and the fellows who stole the beans are still there. They haven't left, so they are also hanging around.
the good thing now they have left, they have gone, they have parachuted over them. You know, mobile money is good that you have eliminated all those people, the officials of government who were procuring beans. That people were saying they were cooking for 8 days and they were not cooking. Full of stones. So now those ones have been eliminated. Let the people get the money quick. So, Honorable Minister, can you kindly talk to government to fasten the process such that your strategic decisions can be taken early enough, then the operational also processes are done next week early, so that people can stop this anxiety of looking around for food. At least those, they stay home. And now we have only people moving around to look for Medicare, and a few of you who are, you know, essential workers to go and make decisions for us, and we move so that we can break this. Otherwise, I saw people now, they have refused to stay home, and it is understandable.
Okay, we are into the next day, surprisingly. It's a Thursday already, but maybe within just 5 minutes, Dr. Chris Baryomusi, there is something that is coming my way, that the Ministry of Public Service has cleared the Ministry of Health to renew contracts of 374 health workers recruited to support the COVID-19 response. Well, it goes on and on and on, but I think it's good news that comes as a piece of information to Honorable Matthias Mpuga in as far as the... Yes?
To the public.
Oh, wow.
Yeah.
Through you, perhaps. Through you. Yeah.
No,
Is government sleeping? The final question for you, Honorable Baryomusi, because in 5 minutes...
In addition to those who are in the...
Exactly. So, the final question that is coming your way, Honorable Dr. Chris Baryomusi, is government sleeping?
No. Government is fully awake. I can assure you that as we speak here on this television, there are committees of government which are meeting. You see, the reason why we put cabinet on Monday is that's why I was cynically asking the LOP that, do you want us to fly helicopters and throw money on people? There has to be a process of compiling the beneficiaries, and that process is now on. So we hope by the time cabinet sits, a lot of work will have been done. We take decisions and agree on when the money can be given. Because you can't just wake up and say, the money is here, you throw it. You have to do a thorough process of profiling those vulnerable people, get their contacts, use the LCs, counter-check the people and so forth. So the process is on, and by the time we meet, take the decision, then we agree on when to give the money. So to answer you, the government is awake during the day, during the night. That's why I'm here. I'm not at home sleeping. No. The government is fully awake, and I want to comfort Ugandans. Despite the crisis that we are facing, the other day the Monitor put a scaring headline. Why did Uganda lose the battle? We have not lost the battle. Yes, there is a crisis, but we are on top of the situation, and for sure, if we take these measures, the infection rates will come down, and we shall be able to surmount this challenge of COVID-19.
There is another headline of money, 200 MPs.
That's also not correct. It's not correct. Yes, some few MPs tested positive, but not 200. And the Parliament...
The Parliament released the document.
Does becoming MP make somebody immune to catching?
No. That conversation...
But that is 50% almost of the population of MPs.
But that's not correct. That figure is wrong. It's not,
that's what makes news.
Well, perhaps what makes news or not will be what we'll be looking at some other time, probably. But we do say rest in peace to those that have lost the battle to COVID-19. We did learn during the course of the day that Everest Kayondo passed on. He succumbed to COVID-19. The man dubbed Kasita. Very, very unfortunate. We've also learned that the Homies Dalen Schools, the branch in Kamocha, has lost a Basa, Madame Angela, COVID-19 still. There is quite a number of those, but may their souls rest in peace. Ladies and gentlemen, it's now that you need to act, or perhaps perish. Keep the mask on. Social distance, like you see what is happening in studio. Do not shake hands, and where need be, use an alcohol-based sanitizer all the time. As you wash hands, make use of soap and water. Please heed to that advice. you will definitely survive.
Get your phone at home and don't forget the sanitizer.
By the way,
percent VAT on water in this pandemic. So you see the troubles.
There's also water crisis.
we need to
in
say
many
goodbye,
areas.
but gentlemen, for you that has been watching us, we've had Dr. Chris Baryomusi, the ICT Minister, and by the way, congratulations upon taking up that office. Congratulations.
Thank you very much.
We could have missed out on saying that to you on air.
It also add national guidance, which
Ah.
is much needed
Yes.
So I am going
in
to
fighting
follow
the
you and
pandemic.
guide you all the time.
Wonderful.
Yes.
Thank you, Sarah. We've also had the leader of opposition, that is Honorable Matthias Simpuga. Congratulations, by the way, as well, on that appointment.
Very
I'm
able.
sure you're happy with the Kamosha leadership.
There's no Kamosha leadership. We have the NUP leadership.
Sorry, NUP
Kamosha
leadership.
is a village. Do you refer to the LC leadership? Or?
I actually grew up in Kamosha. That's why I love Kamosha.
Well,
The
that's
Kamosha
different.
based leadership. That's it.
Dr. Chris Baryomusi. Sarah Beretta, the ED, Center for Constitutional Governance. Thank you so much as well for coming through. And as well, Mr. Economist, Professori Ramadan Gobi. Thank you as well for honoring the invite.
Pleasure.
Ladies and gentlemen, it's a new day. The day is Thursday. It's a new day, the 24th of June. Until we meet again, my name is Kent. Keep it